Over the last 80 years, ophthalmic surgeons have developed many procedures to correct refractive errors in the human eye, experimenting, testing and refining these procedures over time. Naturally enough, great progress has been made in both safety and accuracy, to a point where refractive surgery is now very sophisticated, very safe and extremely accurate. PersonalEyes, one of Australia's pioneers and leaders in refractive eye surgery, offer the largest choice of options when it comes to vision correction, making it possible for thousands of people to achieve a new world of vision, free from glasses and contact lenses, including many who were previously considered unsuitable for the early laser procedures. Today, Lasik is the worldwide procedure of choice for more than 90% of people who wear glasses or contact lenses, with more than 12 million Lasik procedures successfully performed to date. PersonalEyes Medical Director Dr. Kerry Meads was an Australian pioneer in LASIK refractive eye surgery and the first female ophthalmologist to perform laser vision correction in Australia. Dr. Meads has been involved in training countless ophthalmologists in refractive surgery techniques, not just in Australia but throughout Asia Pacific, and has undergone LASIK treatment herself more than 7 years ago. LASIK surgery is done on an outpatient basis, with most people returning to work and even driving the day following surgery. The LASIK procedure involves 2 surgical steps. Firstly, an extremely thin flap is excised from the surface of the cornea. Traditional LASIK uses an instrument called a microkeratome, capable of creating flaps just 1/10 of a millimeter. As an example of ever-improving technology, we can now offer an all-laser process called IntraLase. IntraLase is a very precise computer-controlled laser that the surgeon uses to create the corneal flap. This is a blade-free process, making the procedure an all-laser process. The advantages of IntraLase are flexible flap size and thickness, allowing patients who may not have been suitable previously now to have LASIK. Your surgeon will discuss both options and their cost with you. Be mindful that both procedures are very safe and effective in the hands of our experienced surgeons. The second step in LASIK involves the use of a modern scanning excimer laser, which gently removes microscopic layers of tissue from the cornea. In this way, the cornea is reshaped with precision to your specific eye prescription requirements. The flap is then carefully repositioned to cover the newly shaped cornea. The cornea has amazing natural bonding qualities, and almost immediately, the flap adheres to the underlying tissues, eliminating the need for sutures. This results in the patient appreciating an improvement in their vision straight away. The LASIK procedure is considered so safe that both eyes are normally treated on the same day, with the entire LASIK procedure taking approximately 20 minutes. Most patients will see an improvement in their natural eyesight immediately after surgery, and by the following day, 99% of all patients see well enough independent of glasses to drive a car. LASIK surgery should last your whole life. Once your refraction has stabilized, usually within 1 to 3 months after surgery, the reshaped cornea tends to stay modified permanently. The condition of presbyopia, the need for reading glasses, is common for those reaching their mid-40s. People who've never needed glasses or contact lenses find it increasingly difficult to focus on near objects. They require progressively stronger reading glasses, especially when doing detailed work, typical with hobbies, or when trying to read in poor light conditions. As an alternative to reading glasses, presbyopia can be corrected with LASIK, giving the patient monovision. Monovision is a term used to describe a visual treatment where one eye is utilized for distance vision and the other for near vision. Your original glasses or contact lens prescription will determine whether one or both eyes require laser correction to achieve monovision. The visual concept has worked well for most people who experience presbyopia for many decades. Before undergoing treatment for presbyopia, all of our patients are required to undergo a trial of monovision using soft contact lenses. The aim of this trial is to simulate what your vision will be like after laser surgery. The contact lens trial will give you a very good indication whether this procedure will meet your daily visual needs. Monovision is a lifestyle compromise, and there may be times such as during fine hobby work or when reading the street directory at night in poor light, when additional readers may be of benefit. It is possible for monovision to affect depth perception slightly. Therefore, it's not recommended for people with vocations such as pilots, taxi drivers, truck or bus drivers. The advantage of monovision is that following treatment, you'll be free from glasses for most tasks. Like your fingerprints, each of your eyes is different, with its own unique shape and visual characteristics, including subtle imperfections. PersonalEyes Custom Cornea develops an individualized treatment plan for each eye. The custom cornea technology involves the development of a wavefront map for the eye, enabling a complete and accurate picture of the eye's optical path. There are some patients, however, for whom Lasik is not suitable. This may be because the degree of far or short-sightedness is greater than that which can be safely treated with Lasik, or because of abnormalities in the thickness of the cornea or the shape of the eye. For these patients, we can offer a full range of other corrective procedures. Prior to the development of Lasik, Advanced Surface Laser Ablation, or ASLA, was the first eczema laser procedure. ASLA involves applying the laser beam directly onto the surface of the cornea rather than under a corneal flap as in Lasik. It may be associated with some discomfort and longer visual recovery than Lasik, but it causes less thinning of the cornea and is occasionally preferable to Lasik in lower degrees of refractive error. Lasik stands for Laser-Assisted Epithelial Keratomiliosis. This is a modification of ASLA, where the outer layer of the cornea is gently separated from the underlying tissue prior to the laser treatment and later placed back into position. LASIK is similar to LASIK, but without the thicker flap. Another surgical option is the insertion of a phakic intraocular lens, the newest of these being the implantable contact lens, or ICL. The phakic IOL is ultra-thin and designed to reside inside an eye where the natural lens is still intact. It's like inserting the patient's own glasses or contact lenses inside the eye. The custom-made lens is implanted through a tiny incision in the eye and doesn't affect the appearance or colour of the eyes. This procedure is usually used on very short-sighted or very far-sighted patients who have not reached middle age and do not require glasses for reading. Their corneas are too thin, too flat, or too steep to undergo large amounts of laser reshaping required for LASIK. In this method, the natural lens is removed in a procedure called a clear lensectomy. The surgery itself is identical to routine cataract surgery, with more than 140,000 cataract operations in Australia each year. An artificial intraocular lens of the correct power to give the patient better unaided vision replaces the damaged or imperfect natural lens. This method may be used where LASIK is not recommended and is most commonly performed on middle-aged patients. Where required, PersonalEyes offers a multifocal IOL